about I take you to lunch?
Great. After putting all the care packages together today at church, it'd be nice to not have to go home and cook. Where are you gonna take me?
How about that new restaurant you really like?
Perfect, perfect.
You're still my favorite. I'm hungry. Oh my.
Your server will be right with you. Thank you. You're welcome. Hello, is there 4 of you?
4, please.
Great. How about that table? Your server will be right with you.
Thank you.
You're welcome.
Thank you. Go ahead, guys. Get anything you want. Grandma's paying for you. Yes. You hungry?
Oh, yeah.
Honey, are you okay?
Yeah, I'm fine. Honey, I've got to go to the restroom.
Okay.
Pat! Pat! You okay?
Mark, you okay?
What would you do if you saw someone collapse? You know to call 911, but did you know if you start hands-only CPR, the new CPR without mouth-to-mouth breathing, you will significantly increase that person's chance of survival. Hands-only CPR can double or even triple a victim's chance of survival. You do not need to be certified to perform hands-only CPR. Dr. Jason Sapira is the 2016 North Carolina Doctor of the Year. He is an EMS medical director and an emergency physician. He is an assistant professor at the Department of Emergency Medicine at the Wake Forest University Baptist School of Medicine in Winston-Salem, North Carolina. He has worked diligently for over 25 years to become an expert in cardiopulmonary resuscitation.
Hands-only CPR is a relatively new technique that is easier to learn, easier to perform, and more effective than traditional CPR that uses mouth-to-mouth resuscitation.
If you witness someone collapse from sudden cardiac arrest, taking prompt action could save their life if you follow these simple steps.
I know hands-only CPR. Let me help.
First, place the victim on their back and check for responsiveness by shaking and shouting at the person or rubbing their chest bone hard with your knuckles. Next, direct someone to call 911.
Ma'am, what is your name? Kathy. Kathy, call 911.
If you are alone, you will have to make the call yourself before you begin chest compressions.
Randolph County 911.
A man has collapsed at a restaurant on Dixie Drive.
Is he conscious?
No.
Is he breathing normally?
No.
Begin by positioning yourself at the patient's side near the chest. Place the heel of your dominant hand in the middle of the chest, usually right between the nipples. Then put your other hand on top and lock your elbows. Place your shoulders over the center of the chest and fall, compressing the chest about 2 inches. The reason for this position is that no one is strong enough to compress the chest 2 inches without using their body weight.
It is important that the hands are lifted back to the starting position after each compression. That's because the recoil of the chest creates a little vacuum, causing air to go into the lungs and blood to fill the heart. It's also important to pump on the chest fast, at a rate of almost 2 times per second. An easy way to maintain that beat is to think of the disco song, Staying Alive by the Bee Gees.
He's not breathing. I'm starting hands-only CPR.
Try to compress the chest 100 times per minute. That's almost 2 times per second. It will seem very fast, but you have the best chance of getting the most blood flow at 100 compressions per minute.
In cardiac arrest, oftentimes the heart is just quivering, not pumping any blood. When we compress the victim's chest, we are compressing their heart, making a heartbeat. Compressions need to be almost twice per second to effectively pump blood to the heart and brain so they can respond to further treatment. If compressions stop, blood flow ceases and the person dies.
What if the person gasped?
Gasping is actually a good sign that someone can be successfully resuscitated. If the patient gasps while you're doing chest compressions, continue giving hands-only CPR.
Can you hurt someone by doing chest compressions so deep?
No, you can't. For a victim of sudden cardiac arrest, it is important to make the compressions at least 2 inches deep. Remember, they are dying. It is better to break a rib than to let someone die.
How do you get oxygen into the blood?
If it is an adult that collapses from a cardiac problem, then they typically already have enough oxygen in their body for several minutes. It's a matter of circulating that oxygen to the tissues that need it. Most importantly, the brain and the heart, so they can respond to treatment. For every minute that you delay CPR, the victim's chance of survival drops 10%. So if we wait 5 minutes to start CPR, the victim's chance of survival is less than 50%. We want 911 to be called immediately when someone suffers a sudden cardiac arrest, followed by hands-only CPR until the paramedics arrive. If this happens, we will significantly increase the person's survival rate, but we need your help to do this. It may even save the life of someone you know.
What if you get tired of doing hands-only CPR until paramedics arrive?
It can seem like an eternity waiting for the paramedics. If there's another person there to help, have them take up a position on the opposite side of the victim.
You ready to switch out?
Yes.
You can alternate compressions as you get tired, but try to do compressions for 2 minutes before you quickly switch.
Every minute, someone dies of cardiac arrest in the United States. Nearly every day, it happens to someone in Randolph County. It can happen to anyone, at any place, at any time, without any warning. Your best chance for survival is if someone does hands-only CPR. It's important to note that hands-only CPR is not for infants, small children, or hanging or drowning victims.
We are seeing amazing results throughout North Carolina with hands-only CPR. It is our goal in the coming year to educate 10,000 people in every county in hands-only CPR. EMS, fire, and police units are committed to preventing harm in our communities. Currently, only 1 out of every 4 victims of sudden cardiac arrest receive layperson CPR. We want every victim of sudden cardiac arrest to receive hands-only CPR.
Now you know how to do hands-only CPR. So remember, check for responsiveness, call 911, and start hands-only CPR compressing the chest at least 2 inches at a rate of 100 to 120 compressions per minute. You don't have to check for a pulse. You don't have to clear the airway. You don't have to do mouth-to-mouth. It's easy to do, and it can save someone's life.